Yes, my colleagues in uniform. James William again is my name, medical clinic officer by profession, a certified public manager in USA. The patient. I've decided to make this book a thing for us to discuss, to think about, and I'm encouraging each of you who is still practicing medicine to have a copy of this book. I'm going to read just the back page today as a message, the back page of this book as a message. The patient harnesses the power of multiple stories about Ugandans and their broken health system to deliver a powerful message on the urgent need for reform. The author's long career on the front lines of health and health policy gives her insight and experience. Her strident voice bears eloquent witness to the travails of fellow Ugandans suffering and dying due to an unaccountable and errant health system. This is a call to action and will leave a few readers unmoved. That was Professor John Hopkins after reading this book. And then there's a comment from Dr. Fiona Mukwezi Mpanga, lawyer and academic, Makerere University School of Law. He had to say this about this book. This is a book that policymakers and public interest law practitioners should read and reflect upon. Yes. This is a picture from Toro Hospital. I took it in Toro Hospital, I think, and I ran a story on sewage flowing in Toro Hospital. I wrote a story that was carried by New Vision. Right now, people are pushing and clamoring for change, and the medics were silent. This is a sick healthcare system. If we had sewage flowing in the hospital where we are, and I'm sure the brains that we have at that time, and the brains that are pushing to leadership. If sewage was flowing in the hospital, health workers, if we don't occupy our space, we shall have sewage on the streets. If we had sewage flowing in the hospital at this time, with those good brains, if we don't occupy our space as health workers, we shall have sewage flowing on the streets. James William Mugeni is my name, a medical clinic officer by profession and a certified public manager. I'm just calling upon you, my colleagues, that change should not leave us behind. Change brings in new ideas. Let's not take it lying down. Let's occupy our space. And like I said, the patience, none of those fellas is not a patient or a client. All those fellas are people who can start their heart. All those fellas are people we can rehydrate. All those fellas, like I said the other day, that I put it in a simple Uganda, Museveni kati kutukanika mukanike. It's like remove from the garage, put on the road, remove from the garage, put on the road, tukanika mukanike. So Let's not allow sewage to flow on the streets like it was flowing in the hospital. Thank you for listening.